Treating mesothelioma depends on the overall health and age of the patient, the heart and lung health, the type of mesothelioma cancer cells and how they appear under a microscope, the stage of the mesothelioma, the size of the tumor, the amount of fluid in the abdomen or chest, and whether or not the mesothelioma has been diagnosed recently or if it has recurred. To determine these and other factors, a number of tests and procedures may be used, such as a physical examination, a chest X-ray, a complete blood count or CBC, sedimentation rate, a bronchoscopy, or a cytologic exam. A biopsy, such as a fine needle aspiration biopsy or FNA, thoracoscopy, laparotomy, or thoracotomy may also be performed. As mentioned earlier, treating mesothelioma also depends on the stage of the disease. In order to determine if a cancer patient is in one of the 4 stages, including stage 1, stage 2, stage 3, or stage 4, doctors must follow one of several different staging systems currently being used to determine the severity of the disease. These staging systems include the Bouchard staging system, the TNM staging system, and the Brigham staging system. Each system uses the 4 different stages criteria to determine the level of the disease. Once the stage, type of mesothelioma, and overall health of the patient have been determined, the doctor will explore the various treatment methods. The treatments and methods used for treating mesothelioma can be divided into 2 types: traditional mesothelioma treatments and new mesothelioma treatments. Traditional mesothelioma treatments include surgery, pleurectomy decortication, extrapleural pneumonectomy, pleurodesis, and peritonectomy. Chemotherapy, anti-cancer drugs such as Navelbine, which are usually injected into a vein, and radiation therapy or radiotherapy. Navelbine, also vinorelbine or vinorelbine tartrate, is classified as a plant alkaloid, and it is typically used for non-small cell lung cancer as well as breast cancer, ovarian cancer, and Hodgkin's disease. Navelbine is available in a clear, intravenously administered fluid and in capsule form taken orally. In either case, the administration of Navelbine must be carefully monitored by a physician, and patients must follow a strict regimen of dosage. Chemotherapy may involve several types of anti-cancer drugs, either injected directly into the lungs, taken in pill form, or intravenously. Because different chemotherapy drugs work in different ways, it is common to mix several types of chemotherapy drugs to best target cancerous growth. Navelbine works specifically by inhibiting the development of cell structures. Without microtubule structures, cells do not function properly and die. Essentially, Navelbine tells the cell to develop without this crucial element, causing the cell to abort, halting further growth. Used in combination with a drug such as cisplatin that shrinks cancerous tissue, Navelbine can effectively reduce cancer and work towards remission in a patient. Navelbine is just one option in the arsenal against mesothelioma. Navelbine, like all chemotherapy drugs, may disrupt the growth of cancer cells in patients with malignant mesothelioma. Unfortunately, Navelbine can damage normal healthy cells as well and can cause unpleasant side effects ranging from hair loss and nausea to anemia and hemorrhaging. New mesothelioma treatments include the development of new chemotherapy agents, angiogenesis therapies, interferon and interleukin therapy, immunotherapy, intensity modulated radiation therapy or IMRT, photodynamic therapy or PDT, radiofrequency ablation, gene therapy, and mesothelioma clinical trials. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information.
If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.